And this comes just 1 week after 23 ABC News aired an investigation about how public health was refusing to release the additional demographic data and how the HIPAA statute shows they could have in fact released the data much earlier on. 23 ABC's Tori Cooper joins us from Public Health with more.
Yeah, we have been pushing for this new data to be released for several weeks so that we could see the ages, ethnicities, and geological locations of those who are dying of COVID-19 in our community. And after putting the pressure on the Kern County Public Health Department with our story last week that showed they could have released this information sooner, they released the information today. After pressing public health for months to release additional data of deceased COVID-19 patients, including their ages,
the additional demographic data now includes age ranges, race and ethnicity, and sex of the individuals who are reported to have died from COVID from March through September 30th.
Public Health announced today that the information is now available. Data shows out of 371 people who have died of COVID-19, 12 people died from only COVID-19 and no other underlying medical conditions. Out of the total 371 patients who have died of COVID-19, 247 of them were ages 65 and over, or 67%. 44 people died between the ages of 18 and 49, and 80 people died who were between the ages of 50 and 64. Health officials last week saying they couldn't release this data because it may violate the HIPAA rights of deceased COVID-19 patients. The new data comes just 1 week after 23 ABC determined that under HIPAA statute 164.514, public health could have used the safe harbor method and released this data months ago, showing the ages of people who have died. Using this method, it would have required health officials to scrub through the data themselves and remove certain identifying patient information, which would have allowed health officials to release this demographic data. But the county instead decided to hire an expert statistician back in April to determine what information should be released, which according to documents obtained by 23 ABC has cost the county $23,250. When we asked Public Health today about why they decided to release this information now as compared to months ago when we first asked,
we've been working very closely with the statistician to determine how we could safely and appropriately release this information. We did get the finalized model and it was tested on real data this week. And so we finally got the go-ahead to go ahead and release this information.
Now, it's still unclear why the statistician waited until just this week to test the data when he was hired back in April. Now, documents also show that the statistician is contracted with the county until the end of the year, but it's still unclear. The Kern County Public Health Department is now planning to release further information and new data to the community. But of course, we will continue to follow this story and bring you the very latest right here and on our website, turnto23.com. But for now, in East Bakersfield, I'm Tori Cooper for 23 ABC News, connecting you.